Nearly 60% of women over 50 report dryness itching or irritation down there. What many don't realize is that one natural oil supported by medical research for its anti-inflammatory and microcirculatory benefits can safely restore hydration and comfort when used correctly. I'm Dr. Eliza Hart, a gynecologist with over 15 years of experience helping women navigate the changes that come after menopause. Over the years, I've seen how small, evidence-based habits can completely restore comfort and confidence in this delicate area. As estrogen levels decline, circulation slows, and the tissues down there become thinner, less elastic, and more easily irritated. While many women turn to hormone creams or follow unverified DIY tips online, not all of them are safe or medically effective. When used correctly, castor oil can be a simple, non-hormonal way to reduce inflammation, improve hydration, and support healthy circulation externally. In this video, I'll walk you through 7 doctor-approved ways to use castor oil safely after 50 practical, science-backed, and completely external. If you've experienced dryness or discomfort, type 1 in the comments, and if you're one of the lucky few who haven't, type 0. And before we begin, please subscribe and help me reach my first 10,000 subscribers. Your support truly keeps me motivated to share more evidence-based women's health education for you. 1. Warm external massage, restoring circulation and comfort naturally. When we talk about external feminine care after menopause, one of the most underestimated factors is microcirculation, the steady flow of blood that keeps the skin and tissue around the vulva healthy, hydrated, and resilient. Once estrogen levels fall, these tiny vessels constrict, and the tissue loses both oxygen and nutrients, which leads to dryness, thinning, and that constant feeling of irritation many women quietly tolerate. Improving circulation is not just about comfort. It's about maintaining the integrity of the skin barrier and preventing minor inflammation before it turns into chronic discomfort. A warm external massage with castor oil is one of the simplest and safest ways to reactivate that circulation. Castor oil is rich in ricinoleic acid, a fatty acid shown in clinical literature to support anti-inflammatory activity and stimulate local blood flow. When applied topically, it penetrates through the epidermal layer, softening the outer skin while improving the supply of oxygen to deeper tissues. To do it correctly, warm 1 or 2 drops of organic cold-pressed castor oil between your palms until it feels pleasantly smooth and never hot. Then gently massage the outer vulvar area for 2 to 3 minutes using slow circular motions. The goal is not to rub, but to encourage warmth and comfort in the superficial layer of skin, helping it absorb moisture and regain flexibility. Women who use this technique regularly often notice that dryness decreases within a few days, and the tissue feels calmer and less reactive to soaps, clothing, or friction. For those who tend to experience irritation after bathing or during colder months, this simple step can replace the need for heavier ointments that often contain unnecessary chemicals. Always remember this method is external only and should never involve internal application. After the massage, gently pat the area with a clean cotton cloth to remove any excess oil, allowing the skin to breathe naturally. This small ritual done consistently reinforces comfort and restores confidence in an area many women stop paying attention to after menopause. And once the skin regains balance, it becomes far easier to prevent further irritation, a foundation for everything we'll build upon in the next step. 2. Outer compress, reducing inflammation and calming sensitive skin. While massage restores warmth and circulation, many women still struggle with occasional inflammation, swelling, or sensitivity down there. These reactions often occur when the skin barrier has already been compromised, for example, after irritation, from soap-tight clothing or prolonged dryness. In such cases, the tissue needs not friction, but a soothing compress to calm inflammation and allow the skin to heal naturally. A castor oil compress is a simple yet medically sound approach that supports the area's natural recovery. Research has shown that ricinoleic acid in castor oil helps modulate the body's inflammatory response by decreasing prostaglandin activity, one of the chemical signals responsible for swelling and discomfort. To create the compress, soak a small piece of sterile organic cotton or gauze with a few drops of castor oil until it feels moist but not dripping. Place it gently over the irritated external area for about 10 to 15 minutes, allowing the oil to penetrate slowly and reduce redness or burning sensations. If desired, you can slightly warm the cotton by holding it between your palms before applying. This gentle heat enhances absorption and encourages microcirculation. Unlike topical ointments that may contain preservatives or synthetic fragrances, castor oil provides a pure lipid layer that hydrates while protecting against further irritation. After removing the compress, rinse the skin lightly with lukewarm water and pat dry with a soft cotton towel. For best results, use this method no more than once a day. Excessive application can make the skin overly moist, which is counterproductive to healing. Many of my postmenopausal patients report that within a few days of consistent use, the skin feels calmer, less reactive, and visibly healthier. Some even notice improved comfort during everyday movements, such as walking or sitting for long periods, as the skin regains flexibility and moisture balance. The key is patience and moderation. Allow the oil to work gradually, giving your skin time to repair its natural balance. Once inflammation is under control, hydration becomes the next crucial step. And that's exactly what we'll focus on in the following section. 3. Perineal hydration, restoring moisture and protecting the skin barrier. Once inflammation is under control, the next goal is to restore proper hydration to the perineal and vulvar area. During and after menopause, estrogen levels drop significantly, causing the skin's natural oil production and collagen density to decrease. The result is dryness, thinning, and a loss of elasticity that make the tissue more prone to irritation and minor tears. Unlike typical body lotions, which are often too acidic or filled with fragrance, castor oil provides a neutral, stable lipid layer that supports the rebuilding of the skin's barrier and locks in natural moisture. For external use, apply 1 to 2 drops of organic cold-pressed castor oil to clean, dry skin. Gently spread it over the outer vulvar folds and perineal region using soft fingertips. No rubbing or pressure is necessary. The oil will naturally melt into the skin's surface, forming a light, breathable coating that retains hydration for hours. Many women find that applying it after a shower or before bedtime works best, as the skin is warm and the pores are slightly open, allowing for deeper absorption. From a medical standpoint, this method works because castor oil's fatty acids strengthen the skin's lipid barrier and limit transepidermal water loss, a common cause of chronic dryness after menopause. In addition, its mild antimicrobial properties help maintain the natural pH balance without disturbing beneficial bacteria. The result is smoother, softer skin that resists irritation and heals faster when exposed to heat, soap, or friction. If you are using prescription estrogen cream or a topical moisturizer prescribed by your doctor, this method can complement rather than replace it. Simply alternate days or apply castor oil several hours apart to prevent interference. Over time, consistent hydration will improve comfort, reduce itching, and make the tissue less reactive to external triggers. It can also help relieve the mild burning sensation that often appears after long walks or exercise. With the skin now fully nourished and protected, we can turn our focus to addressing one of the most common yet rarely discussed postmenopausal concerns, hemorrhoidal discomfort. 4. Hemorrhoid relief, soothing inflammation and supporting healthy circulation. As we age, circulation throughout the lower pelvis naturally slows, and pressure within the veins of the rectal area increases. This change, combined with hormonal decline and a less active lifestyle, explains why hemorrhoids are more common in women over 50. Although the condition is benign, the pain, burning, and swelling it causes can make even simple activities like sitting or resting deeply uncomfortable. Fortunately, topical castor oil offers a safe, natural way to calm inflammation and support better blood flow in this delicate area. Castor oil's main component, ricinoleic acid, acts as a natural anti-inflammatory agent by reducing prostaglandin levels in inflamed tissue. When applied externally, it helps shrink swollen veins, lubricate the affected skin, and promote faster healing. To use it correctly, soak a small piece of organic cotton or a cotton ball in castor oil, then place it inside a clean, freezer-safe container for 2 to 3 hours. Once chilled, not frozen solid, gently press it against the affected area for several minutes. The combination of cool temperature and oil reduces pain quickly, while improving circulation to encourage recovery. For women who prefer a milder sensation, you can simply apply a thin layer of oil with a clean fingertip or soft cloth instead of using the cold compress. The effect is less immediate but equally beneficial when performed daily. Always clean the area gently with warm water before application and avoid harsh soaps or wipes that can worsen irritation. After several days of consistent care, most women notice a reduction in swelling and improved comfort during movement. Remember that the goal is not instant relief, but gradual restoration of tissue health and circulation. If you've ever dealt with occasional hemorrhoidal irritation, I'd love to hear what has helped you. Type yes in the comments if you've experienced this issue, or no if you haven't, so we can see how many women silently share this challenge. Your feedback truly helps guide future topics and builds a space where midlife women can learn without embarrassment. 5. Scar and stretch mark care, restoring skin, strength, and elasticity. Beyond comfort down there, many women after menopause notice visible changes in the surrounding skin, especially around the hips, thighs, and lower abdomen. The natural loss of collagen and subcutaneous fat leads to reduced elasticity and the formation of stretch marks or minor scarring after surgeries or childbirth. While these changes are completely normal, they often make the skin appear fragile or uneven in tone. Consistent topical care can help strengthen these tissues and restore a smoother, healthier texture without relying on synthetic creams. Castor oil is particularly effective for this purpose because it contains a high concentration of triglycerides and omega-9 fatty acids that penetrate deeply into the dermal layer. These lipids nourish fibroblast cells, the same cells responsible for producing collagen and elastin, two structural proteins that maintain firmness. By stimulating mild microcirculation, castor oil encourages new collagen formation and softens fibrous tissue that can make scars appear raised or tight. To apply it safely, use 2 or 3 drops of organic cold-pressed oil gently warmed between your palms. Massage it in slow circular motions over the lower belly and hip area for about 5 minutes once daily, preferably at night when skin repair is most active. With regular use, many patients observe gradual fading of older marks, smoother texture, and improved flexibility of the skin around surgical scars or stretch lines. It's important to note that results depend on consistency. Visible changes typically appear after 3 to 6 weeks of daily care. For added benefit, you can layer the oil beneath a thin cotton cloth to retain warmth, enhancing penetration and collagen activation. As the skin becomes firmer and more resilient, it also supports the pelvic region by improving circulation and comfort during daily movement. When the tissue surrounding the pelvis feels stronger and more supple, it contributes to overall well-being, preparing your body for the next step, where we'll explore a gentle yet highly therapeutic practice that extends these same benefits in a more relaxing, full-body way. 6. Sitz bath with castor oil, enhancing circulation and gentle relief. For women who prefer a calm, spa-like approach to intimate care, a sitz bath with castor oil offers an excellent balance between comfort and medical effectiveness. This practice has been used for decades in gynecology to promote circulation, reduce inflammation, and support healing in the lower pelvic area. When combined with the anti-inflammatory properties of castor oil, it becomes one of the safest and most relaxing methods to maintain pelvic and perineal health after menopause. To prepare the sitz bath, fill a shallow basin with comfortably warm water, ideally between 37 and 40 degrees 98 to 104 degrees. Add 1 to 2 teaspoons of organic cold-pressed castor oil, then mix it thoroughly until a thin film forms on the surface. Sit in the basin for 10 to 15 minutes, ensuring that the water gently covers the vulvar and perineal area. The warmth helps dilate blood vessels and increase oxygen delivery to the tissues, while the oil reduces inflammation and restores hydration to dry, irritated skin. This method is particularly helpful for women who experience lingering soreness, burning, or tension after long periods of sitting. Regular sitz baths improve lymphatic drainage ease, mild pelvic congestion, and support the regeneration of delicate tissue. Because castor oil has natural antimicrobial properties, it can also help maintain pH balance and reduce minor irritation caused by soaps or synthetic fabrics. After the bath, rinse gently with clean water and pat the area dry with a soft towel. Avoid wiping or scrubbing as friction can undo the benefits of the treatment. Clinically, this approach offers a mild but cumulative benefit when practiced 2 or 3 times per week. Most women describe a sense of deep relaxation and restored comfort immediately afterward. For safety, ensure that the oil is used only externally and that the basin is properly cleaned before each session to avoid bacterial growth. With regular practice, this simple home method strengthens circulation and promotes ongoing tissue resilience, creating the perfect foundation for the next technique, which focuses on internal support through the abdominal wall. 7. Abdominal massage, supporting pelvic circulation and hormonal balance. The final technique focuses on an area often overlooked in women's self-care, the lower abdomen. Gentle abdominal massage with castor oil not only improves circulation to the pelvic organs, but also helps reduce bloating, mild discomfort, and tension that many women experience after menopause. As estrogen levels decline, blood flow to the uterus bladder and intestinal region becomes less efficient, which can slow lymphatic drainage and contribute to a heavy or congested feeling in the lower body. Restoring that movement is key to maintaining long-term pelvic health. From a clinical perspective, castor oil is particularly well suited for this use. Its molecular structure allows it to penetrate deeply into the skin, supporting local detoxification and microcirculation. When combined with light rhythmic massage, it enhances venous return the movement of blood back to the heart and encourages gentle stimulation of the abdominal organs. This helps reduce swelling, relieve mild constipation, and promote the natural balance between the digestive and reproductive systems, both of which can become sluggish with age. To perform the massage, warm a small amount of organic cold-pressed castor oil between your hands, then apply it over the lower abdomen from the navel down to the pubic bone. Using the pads of your fingers, move slowly in clockwise circles for 5 to 7 minutes, keeping the pressure light and consistent. This direction follows the natural flow of the colon and promotes effective circulation. For added relaxation, you can place a warm compress or heating pad over the area for a few minutes afterward to further encourage absorption and comfort. Women who practice this routine regularly often report feeling lighter, more energized, and less bloated. In medical practice, I've seen it complement treatments for pelvic floor relaxation, urinary urgency, and even mild lower back tension. It's not a substitute for medical therapy, but a supportive habit that enhances recovery and comfort naturally. With the body now more balanced and the pelvic tissues fully nourished, we can move toward a sustainable routine that brings all 7 methods together into a gentle, consistent plan for lasting results. At this stage, you've already learned 7 safe and medically approved ways to use castor oil effectively for postmenopausal care. The next step is applying them in a gradual and consistent manner so your skin and pelvic tissues have time to adapt. Gentle progress ensures that hydration, circulation, and elasticity improve without overwhelming the delicate areas involved. Think of this as a structured routine rather than a list of treatments, a plan that works with your body's natural rhythm. During the first 2 weeks, focus on the basics: circulation and hydration. Start with the warm external massage 2 or 3 times a week to gently reactivate blood flow. Alternate this with perineal hydration on the remaining days to rebuild the skin's moisture barrier. These early steps prepare the tissues for recovery by increasing oxygen delivery and softening the outer layer of skin, allowing other methods to work more effectively later on. In the 3rd and 4th weeks, begin adding anti-inflammatory support. The outer compress can be introduced once every 1 or 2 days to help calm sensitivity or swelling. Continue your massage and hydration routines, but adjust their frequency based on how your skin responds. This is also the right time to try a sitz bath 2 or 3 times a week, which promotes pelvic relaxation and helps lymphatic flow. Most women notice clear improvements in comfort and texture by the end of this phase. By the 5th and 6th weeks, your goal is maintenance and strength. At night, apply a small amount of castor oil to the lower abdomen and hips to improve elasticity and reduce the appearance of stretch marks. Alternate this with light abdominal massage 3 times per week to enhance tone and flexibility in the pelvic region. If you experience occasional hemorrhoidal irritation, the cold compress method can still be used as needed for short-term relief. Throughout this 6-week plan, choose only organic cold-pressed castor oil stored in a dark glass bottle to maintain its purity. Avoid internal use at all times and track how your body responds weekly. Remember, improvement is gradual. What matters most is consistency, not speed. Small, steady progress leads to lasting comfort, better circulation, and healthier skin that reflects true postmenopausal well-being. Castor oil is not a miracle cure, but when used properly, it becomes a powerful ally for women navigating the physical changes that come after menopause. Each of the 7 methods we've discussed focuses on one key principle: restoring balance. Whether it's improving circulation, calming inflammation, or reinforcing the skin's moisture barrier, every step works toward the same goal: helping your body recover its natural rhythm and comfort. For women over 50, these small daily or weekly routines often create noticeable improvements in just a few weeks. The key is moderation and consistency. Always use high-quality, organic, cold-pressed castor oil, and remember that gentle, external care is far safer and more effective than any internal or experimental approach. Listen to your body, observe how your skin responds, and make small adjustments along the way. Your goal is not perfection, but long-term comfort, confidence, and health in the most natural way possible. If you found this video helpful, please share it with another woman who could benefit from learning safe, science-backed feminine care. Leave your thoughts or experiences in the comments. I read every one of them. And before you go, please subscribe and help me reach my first 10,000 subscribers so I can continue creating more educational videos to support women's health and well-being after 50.